Estradiol is the female-defining hormone, but it has other important functions, and that is why the man needs it too. Let's look at the effects. The menopause and the problem of estradiol dominance. As I said, it is the female formative hormone. It starts during puberty. It transforms the girl into a woman. All secondary sexual characteristics are triggered by estradiol, breast formation, the onset of menstruation, and so on. And then, in adulthood, it is important for the build-up of the endometrium. It prepares for a possible pregnancy, and then there is a peak that triggers ovulation. Here you can see a picture of how the estradiol level behaves in the course of a female cycle. The blue line is the normal level you should have. The dashed black lines are the upper and lower limits. And the red dot there in the picture is a measurement of this patient. You see, in the first half of the cycle, the estradiol bobs along, and then before ovulation comes this peak. It is a push that triggers ovulation, and in the second half of the cycle, it is slightly higher than in the first. The goal of these hormones is to support a possible pregnancy. However, estradiol has other functions in the body of a man and a woman. Very importantly, it prevents or slows down osteoporosis. It promotes sleep. Estrogen deficiency can lead to sleep disorders. It regulates the body temperature. It stores water in the skin inside the fatty tissue. Young skin is much smoother than older skin, and this has a lot to do with estradiol. It also improves blood clotting, and it controls or supports the thyroid gland. These are the broader effects of estradiol. Now, regarding the menopause, I keep hearing people say, yes, after the menopause you no longer need hormones. The ovaries can also be taken out. They are non-functional. Please don't believe that. We need hormones until the last day of our life. Both men and women. Hormones are essential for life and important for the well-being and function of the body. In this regard, hormones play a big role even after menopause. Especially the estradiol drops during menopause, about 30 to 40%. Estradiol does not drop to zero, as it is so often said. And it is important that estradiol only drops down a little bit. When it drops too fast and too much, it triggers heat flush. Now, for the treatment of flushes, I advise you, please do not use artificial hormones. These hormone patches you get from the gynecologist are artificial estradiol. They are useful, but they also have negative effects. I have made a special video about the bioidentical hormones compared with artificial ones. If you're interested, watch it afterwards. There are ways to treat it biologically. There is a plant, which is called simifuga in Latin. This product is very effective. For milder forms of flushing, I recommend this plant. It increases the estradiol in the body, and if there is not enough, you need a bioidentical estradiol ointment, which is applied here on the arm, and you can see how the heat flushes go away when the level of estradiol rises again. There are other ways to increase estradiol in lower forms. These include red clover, almonds, vitamin D, and most specifically, beer. Maybe you have already seen that men who drink a lot of beer develop breasts. This is related to the additional amount of estradiol triggered by the beer. Now, to the problem with estradiol dominance. This term is not actually recognized in conventional medicine, but I see it all the time when I measure hormones in saliva. Then, often the estradiol compared with other hormones are too high in comparison, and of course that has negative effects. What I often see is estradiol dominance caused by physicians because estrogen ointments are prescribed again and again, just like that, without measuring any levels. I've seen saliva test values reach the highest levels the testing machine can measure multiple times. And these values are extremely high, up to 20 times overdosed. You just can't do something like that. When you prescribed hormones, you have to keep on testing levels in saliva. This is better than blood tests. If you take the blood measurements, then you have normal values. They can range from 1 to 20. And this broad range is just not really serious. It simply doesn't make sense to have hormone levels going from 1 to 18 or more and suggest everything is normal. For saliva measurements, the threshold is very narrow. The range only has 30 to 40% difference. So here, I see very precise measurements of hormone levels and can control the doses very well without risk or overdose of deficiency. Estradiol dominance has an impact in breast cancer in women. That is why this control is so important. In men, the estradiol dominance leads to prostate enlargement. It is one of the main factors when too much estradiol is in the body compared to the testosterone. Those who prescribed hormones must seriously control them.